Morning, and thank you so much for being here. I am State Senator LaTanya Johnson. I represent the 6th Senate District, and it is such an honor to have you here celebrating the second week of Black History Month with us. We are going to have a roundtable discussion with Wisconsin state agencies. In this 2021-23 state budget, Governor Evers and his administration and the other state agencies prioritized the health and mental health and overall well-being for families here in Wisconsin, and also for the students and communities. Today, we will hear directly from these state agencies and departments about how they prioritized investments to improve the health and well-being of African American Wisconsinites in their budget request, what they see as major challenges to addressing these disparities, and what they hope to accomplish within their agencies to improve the outcomes for the African American community today and also for the future.
For those of you who do not know me, my name is Kevin Carr, as the Senator said, and I'm the Secretary of the Department of Corrections. Now, while we celebrate Black History Month, I believe it'll serve us well to remember some stark realities related to the criminal justice system that our administration and the elected officials participating in today's event are committed to addressing. And I know how seriously the electeds on this panel today take the issue of criminal justice and criminal justice reform. Today, there are more than 6 million adults in the United States who are either incarcerated or on correctional supervision. Nationwide, and in our state specifically, the disproportionate rates of Black and brown people in our prisons is staggering. In Wisconsin alone, we have around 20,000 individuals incarcerated in our 37 facilities and approximately 63,000 individuals on correctional supervision. Approximately 9,000 people are released from prison and return to our communities every year. Our current corrections budget is approximately $1.2 billion a year. Well, it's really biannual. And currently it costs about $44,000 a year to house someone in prison compared to less than $4,000 a year for someone to be on community supervision. Now, today, I'm going to focus my comments on mental health. And my goal is to provide you with a high-level overview of what we do at the Wisconsin Department of Corrections to address the mental health needs of the persons in our care. I've had the honor and privilege since 2019 to serve under Governor Evers as the Secretary of the state's largest cabinet agency. We're responsible for 36 adult facilities across the state that house around 20,000 people. And we also operate a secure youth facility that houses about 50 children. In addition, we're responsible for supervising those 63,000 folks that I told you about earlier who are under correctional supervision in communities all across this state. We employ about 9,000 staff, and that includes approximately 200 staff working in behavioral health care fields in our institutions, and about 20 psychology staff working at the Division of Community Corrections. And they provide support to the agents with mental health programming consultation for the persons under supervision. Now, our job at DOC is not, and I repeat, it's not to punish the men and women in our care. That punishment was set forth by the judge when the judge made a ruling to remove that person from society and sentence them to prison for a set period of time. We know that 95% of those currently in our facilities will be returning to our communities. Therefore, it's critically important that DOC invest in and prioritize programming and treatments that can help people prepare to live crime-free, productive lives when they return to their neighborhoods. Everyone who comes into our care receives a mental health screening. And currently, about 41% of the persons in our care have accessed mental health services while at our facilities. Of those 41%, another 25% of them are under prescriptive care, and 10% have been diagnosed with serious mental illness. In our female correctional system, more than 90% have been diagnosed with a serious mental illness, with the top diagnosis being post-traumatic stress disorder. Getting people ready to return from incarceration requires the DOC to invest in evidence-based programming that targets needs in education, substance use disorder treatment, job readiness, and of course, mental health. When I became the secretary in 2019, I tasked our staff with finding opportunities to enhance critical programming, and I'm happy to report that we've made strides in the mental health arena. Even with significant changes in operations to adjust for the COVID-19 pandemic, the DOC is still prioritizing evidence-based treatment and programming. While I'd like to talk to you about a few of those programs at this time. One is Opening Avenues for Reentry Success, or the program that we call Orrs. The Orrs program is a partnership with the Department of Health Services that serves individuals with serious mental illness who are going to be released back to the community. This is an intensive program involving multiple staff working with targeted individuals both prior to and after their release and during their first 3 years of community supervision. Since the start of this program, since the start of our administration, we have proposed that this program be expanded statewide. Unfortunately, the legislature has declined our proposal. Still, with a smaller pool of funds, we've been able to expand the program by 17%. As a result, in 2021, the Orrs program served 463 people transitioning back to their community. Another area where we've made a lot of progress is telehealth. This allows a medical provider to deliver healthcare and mental health services virtually through video conferencing as opposed to an in-person visit. We used telehealth services prior to the pandemic, but COVID-19 forced us to speed up our plans to expand telehealth services, not just within our correctional facilities, but also in community corrections. We can now more easily provide health services, including mental health services, in rural communities and to people who do not have reliable transportation. I'm happy to say that telehealth is now something we can offer at all of our facilities and in all of our regions of our Division of Community Corrections. Peer support is another important aspect of mental health care. Our Certified Peer Support Specialist program trains and certifies persons in our care that have lived experience with mental health and/or substance use concerns. They can then help others through shared understanding, respect, and mutual empowerment. The good news is this program will be expanded to all medium and maximum security facilities by the end of this year. We provide the training and pay those who are certified to work with their peers. These peer support specialists can help others, but also they take their certification and skills out into the community with them when they return home. Another example that I'd like to talk about is the transformation of our youth facility. This administration believes the care of youth in secure environments should look very different from an adult institution. As I'm sure you're aware, back in 2018, after years of documented concerns related to excessive use of force, including the use of chemical agents at Lincoln Hills Copper Lake, the previous administration negotiated a settlement agreement in federal court. One of my top priorities as secretary was to comply with the federal consent decree to transition the schools to an evidence-based treatment facility. Staff there no longer use OC spray. And beginning in 2021, the schools adopted and began a training program model based on positive reinforcement for good behavior, using the tenets and models of dialectical behavioral therapy. And we continue to increase our level of substantial compliance with the elements of the consent decree. The court order appointed monitor does quarterly reports, and those reports can be found on our public website. Like the monitor, we would like to see the youth at Lincoln Hills Copper Lake move to a secure facility closer to home and offer culturally relevant programming. We were disappointed that the legislature did not take up Governor Evers' proposal to do so in his most recent budget. And that proposal was for them to fund a new Type 1 facility in the city of Milwaukee. But we know that lawmakers on both sides of the aisle want to make this happen, and we remain hopeful for a bipartisan solution that can move those plans forward. And finally, Wisconsin DOC is continuing its commitment to meet the Prison Rate Elimination Act, or PREA, standards through the development of a transgender housing policy. We're adding gender identity to our list of considerations when finding suitable housing for people in our care. While gender dysphoria is not a mental illness, it can lead to anxiety disorders, depression, schizophrenia, and even eating disorders. This new policy brings the Wisconsin Department of Corrections in line with national standards. Now, it's important to note that for us to keep moving forward and to provide more programming and health services, we need to have the infrastructure to do it. And I want to share a list of projects where funding has been approved by the legislature and the work is either underway or recently completed. A new residential treatment and diversion building at Oshkosh Correctional Institution. A new programming building and new health services unit at Wisconsin Secure Program Facility. An assistant needs facility that was just completed at Oak Hill Correctional Institution that will serve our entire population. And I just toured that facility and it's just beautiful. And it's really going to serve a very dire need for those who need that type of healthcare. And a new health services unit for Stanley Correctional Institution that's currently in the design phase. Now, Governor Evers has asked the legislature for more in his budget proposal last year, but we don't always get everything that we want. However, we'll continue to look for areas where we can improve our programming and health services and to keep fighting for the necessary funding to bring those ideas to fruition. I invite you to visit our website and spend some time researching the programs and services I've mentioned. I also encourage you to call your legislator and ask them to support more funding for mental health services for the persons in our care. I'm sure you've read that the Legislative Fiscal Bureau recently released numbers, and the state of Wisconsin is expected to have about $3.9 billion in available surplus funding. This is a historic amount of money, and I think some of it should be invested in mental health services and other critical programming that can have a real impact and a real lasting impact for the people of our state, including those involved in the justice system. Unfortunately, so far the legislature has declined to authorize the use of those funds to date. Along with expanding and enhancing the initiatives that I've summarized, even a portion of those funds could be invested in community mental health programming and frontline resources to support prevention and intervention. As long as I'm the DOC secretary, I will continue to listen to the experts in the field and invest time and effort in evidence-based programming that will support the people in our care and clients under supervision. Thank you for your time, and thank you for listening.
You spoke briefly about Lincoln Hills. I'm wondering if you could give us some expansive understanding on what's happening with Lincoln Hills, particularly as it relates to the closure. I know we had set a date in previous budgets on the closure of Lincoln Hills. I'm wondering how much closer we are to that date, and if you can give us some further expansions on
the legislation that established a date for the closure of Lincoln Hills was in July of 2021. That date has come and gone. Obviously, our administration has the strongest desire to close Lincoln Hills as soon as possible. As you may recall, the governor did request $41 million in his requested budget so that we could relocate that facility from Lincoln County to Milwaukee County, but the legislature failed to include that funding in the budget that eventually was passed. With that being said, we continue to make tremendous progress towards meeting the requirements of the consent decree. The court-appointed monitor's most recent visit was last month, and it showed continued improvement. And all of the monitor's reports are posted on our website, as I previously mentioned. I encourage you to take a look at those because we have done a tremendous amount of work since January of 2019 during our administration to change the physical layout of the place, implement more therapy and dialectical behavioral therapy to try to be a more therapeutic type of environment rather than a punitive environment. But there's still a whole lot of work to be done up at Lincoln Hills, but the reports provide a lot of information about the steps our administration has taken so far, and we're real proud of the efforts that we've made. Now, as far as the new facility, which was your fundamental question, we hope that some recent legislation that is, a hearing was held yesterday. There's going to be another hearing in the Assembly next week on funding for this new facility, that if that funding is approved and we can ultimately agree on a location, we hope to have that facility built within the next 4 years, 5 years at the most.
I know one of the areas being discussed for the location is Felmers Chaney in Milwaukee. Can you talk a little bit about why that location is so important and what that means to the timeline of closing Lincoln Hills if it's approved?
There was a site selection committee that was created under the previous administration that identified several locations that two type 1 facilities could potentially be built on. Eventually, that site selection committee picked Hortonia and then a location in Milwaukee, in the city of Milwaukee. Ultimately, the site in Hortonia, which is in Outagamie County, did not have any community support and ultimately was not considered acceptable by the Joint Committee on Finance. Secondly, the site in Milwaukee was it had no community support either, okay? And we had a tremendous amount of difficulty convincing the community that it was a safe facility that would actually be not only an asset to the area wherever it was located, but that it would greatly serve to the benefit of our youth. With all that being said, recognizing how difficult it is to gain community support and find a location to build a new facility, and you know the term that's normally described to that's used to describe the situation that we've been dealing with is not in my backyard. Nobody wants it in their community, right? So we looked at it and we said, well, what if we looked at converting a location in the city of Milwaukee that is already accepted as a corrections facility? And that's one of the reasons why we looked at Felmers Chaney. Marshall Shearer was too small. You know, their footprint was too small. Obviously, the Milwaukee Women's Center, that's not going to work. That's too small. The Milwaukee Secure Detention Facility is a high-rise building. We're not tearing that down to build a new facility. So that left us with Felmers Chaney because it fit the need. Now, that community where that is located has already accepted the fact that there's a correctional facility there. So we believe that just changing its function from adult males to juveniles would be the quickest way that we could get our kids closer to home, which everybody professes to want. Even the advocates that don't want us to use Felmers Chaney agree that we need to get our kids closer to home so that they can have more culturally relevant programming, be closer to their families, and all of those other benefits that are going to help our youth, who are our future. Those are our kids, okay? The better that we can get those folks integrated back into our community, I think is in the best interest of public safety in the long run in our community. And the governor agrees with us. That's how come he put that in the budget, that he wanted the $41 million to build a new facility somewhere in Milwaukee County. And we believe that if we use the Felmers Chaney location, we can save maybe 2 years off the building timeline compared to if we have to start from scratch. Trying to create a committee, find a new site, et cetera, et cetera. Now, with all that being said, Senator, and I'm going to finish with this, that's just our plan. If somebody else has another location that meets our needs and has community support, we're certainly willing to consider that a possibility. But absent somebody coming forward with that type of location, we have to do something to try to move this issue forward and get our kids closer to home.
A quick follow-up on that. There is enough space for what the plan is, or for what the facility will look like at Felmers Chaney for what the Department of Correction wants to do for juveniles in terms of Lincoln Hills, right? Because I've heard some people say that there's not enough space there.
That's not correct. We have already gotten a preliminary site, some site work done with a preliminary design that will fit on the existing footprint. Now, there is some adjacent land that, you know, ideally, you know, that belongs to the city of Milwaukee that we would be interested in acquiring that would give us more space and additional options. But the acquisition of that land is a luxury. It's not a necessity.